I believe they've signed a lease. And I wanted to point out that I'm not conflicted in this. I'm not being paid by any side. I'm just a resident of the town. I understand that many of the people who are in favor have an economic interest, and I think they should point that out. One of my friends, I think tonight, may mention that there's a Colorado study that there's a drain on municipal resources in the courts and the police that outweigh any tax benefit. Point number two, the 2% tax revenues are, of course, the number of revenues is inflated. Equally, the revenues to the state, to the city go to zero in 2 years. So the revenues you're receiving are only for year 1 and year 2. Point number three, this is horrible for people's property values. I don't think you have a single home buyer moving to town who's going to want schools and a commute who's going to say, yay, I have a weed store in town. Point number four, a tremendous number of children live near the facility. Our Glenwood School is about 2,000 feet away from this. The Hartshorn Middle School and High School are just a few minutes away. And most importantly is the children who live right behind the store. This store is in the backyard, less than 40, 50 feet from a half dozen to a dozen little kids in Glenwood. And that's unacceptable. Those kids are going to be on their patio smelling the secondhand smoke of pot users who are going to be in the back of the store and smoking. It's virtually a guarantee that this store is going to have recreational marijuana. So what I ask you right now is, in the future, when recreational marijuana is there, are you going to post a policeman full-time 24/7 behind the store to make sure that people aren't smoking in someone's backyard? And what's the cost of that to the town? So for the limited resources that we're going to receive in tax benefit, weigh the cost to the court system and to the police. Thank you very much.
Thank you.
Hi, thank you. Pavan Arora. I live on Canterbury Lane. I am one of the houses bordering where the marijuana store is meant to be. I can agree with all the economic benefit, and I can agree with the drain on social services, but quite frankly, with the inevitability of recreational marijuana being approved all around the country, and I don't have a stake in the game. I also, to the previous resident's point, want to state that I have no economic interest either way, but I have a kindergartner and a second grader, and I've got kids, teenagers who are hopping my fence to get to Panera so they don't have to walk all the way around, or to get to Chipotle, and I'm sure it'll be more when there's a Wawa. Well, quite frankly, do I care that much? I care about the kid's safety, the teenager's safety who's hopping my fence, but I can't imagine what'll happen when recreational marijuana becomes acceptable. I understand this is a medical thing, but this is, we know that this is where it's going. And so I just want to let you guys know that there are children involved here. So when you make that decision, I know it's an economic one first, and I think we have enough proof across the studies to indicate that it'll be a more higher drain than it will be of value, but don't forget the kids. Okay, thanks.
Thank you.
Deb Fox, 78 Mountain View Road. I consider myself a very liberal person and am somewhat surprised with my attitude on this issue. I'm not opposed to the legalization of marijuana. However, I'm not in favor of a dispensary in our town. While this will start out as a medical marijuana dispensary, once marijuana is legalized, this store will quickly be open to everyone. I recently conducted 45 in-depth interviews on behalf of an association that deals with alcohol responsibility and impaired driving. I spoke with industry executives, educators, law enforcement officials, policymakers, and government officials, and every single person I interviewed mentioned their concerns of the effects of marijuana on drivers, and especially the combination of alcohol and marijuana. They've actually been successful at lowering the number of drunk driving accidents and fatalities, and now they need to deal with this new addition. There are no roadside tests for marijuana levels. So a driver could be extremely impaired, but their blood alcohol level would be below the legal limit, and even with a combination of alcohol and marijuana. If we have a dispensary in our town, people will be driving to our town to make purchases and perhaps using their purchases before they leave town. Driving through complete street in Millburn is tough enough when you're straight. I don't think we're equipped to have impaired drivers driving through. I don't know what the financial benefit will be to the town. but it will not come without a price tag to the taxpayers. We will need additional law enforcement. We will need to rip up complete streets to allow for two-lane traffic on Millburn Avenue for this additional traffic. We were concerned about the safety of having a 24-hour 7-Eleven on the corner of Millburn Avenue and Vauxhall Road, but we're not concerned with a marijuana dispensary. The clientele of this store will not all be Millburn Short Hills residents. People will come from neighboring towns that do not hold our town in the same high regard that we do. I don't know that these people will be frequenting other businesses in town. It pains me to say this, but I think there could be an impact on the crime rate, which is already high because of mall shoplifting incidents. And I hope you'll take this into consideration.
Thank you.
Thank you.
Hi again. My name is Sujoy Menon. I am a medical doctor. I live in town. I live on Elsewhere Road, and I frankly don't care about the financial benefit to the town because it's not worth it. I have dealt with children. I have dealt with adults with marijuana addiction. Yes, I'm not opposed to legalizing marijuana when it comes to responsible adults, just like liquor is. And that's the usual argument that's always placed. But in this case, I'm extremely opposed to it, not only from a resident standpoint, but from a medical standpoint. It is, as has been proposed for decades, it is a gateway drug. It's accepted. There's countless literature out there. We're all talking about this because this will eventually lead to recreational marijuana dispensary. I'm not against medical marijuana. My wife actually is also a physician, and she deals with medical marijuana for chronic pain patients and for cancer patients, and it's a miracle drug for cancer patients. But when this goes to recreational marijuana, as has been pointed out by the previous speakers, this leads to different aspects of human behavior. We're talking about traffic, we're talking about disabled drivers, and also children. Don't forget the children. There are children around this medical dispensary, marijuana dispensary. They're going to be around there for a long time to come. We all moved to this town to create a safe haven for our kids. I have two kids. One is in Deerfield and one is in the middle school. And I don't want them to be associated with marijuana growing up or with friends who are addicted to marijuana growing up. It's not a harmless drug. Keep that in mind, please. Thank you.
Thank you.
Good evening, Mayor and Township Committee members. I'm Manindra Kumar, live in Clive Hills Road. Most of what I'm going to say today is not from me, but from my dear friend Sanjeev Vinayak, who couldn't be there today because he was traveling. He has worked in this industry for a number of years, both for the industry, and now after going through all his dealings, he has completely flipped. So what I'm going to tell you is, first let's get the fact. Marijuana is still classified as Substance 1 federally. What does that mean? No university can do any research on this. So a lot of people talk about medical benefits, but where is that literature? Like, there is not enough research has been done to prove that. So no real university which receives federal grants can do any research on this. Now, what people talk about different ad hoc studies, but really how much proof you can or how much weight you can give to that. No national bank or HR companies can work for this. So again, because of the same reason. Now, marijuana mainly consists of two kinds of cannabinoids: CBD, which you can find even in hemp, and THC, which gets you stoned. Now, a lot of companies talk about CBD, but they don't tell you how much THC it has. So we need all those facts, which I'm sure they will try to hide. So earlier last year, middle of the last year, 2019, Phil Murphy has passed the law which allowed physicians and advanced practice nurses to actually write the prescription for it. So no longer it will be just the physicians, even the junior people couldn't write it. Earlier there was only one caregiver per patient. Now there are two. So think about multiplier effect. And for the people who want to take the delivery, now there is a home delivery option. So why do we need the shop in our town? Just get it home delivered, right? And then people talk about economic benefit. Let me tell you, It's going down to 4% starting July of this year, going down to 2% next year, and going down to 0 in 2 years' time, meaning that in 2 years' time, the economic benefit is 0. Now, the other things which has been proposed in Phil Murphy's argument, raising the monthly limit from 2 ounces to 3 ounces, again, possibility of raising nefarious uses. Also, extending the authorization period from 90 days to 1 year. So once a TA or a physician or a physician assistant or a nurse practitioner signs it, it is valid for 1 year. So think about all these before you're taking any decision. I would say no for our kids, say no for our traffic safety, say no for our finances. Thank you.
Good evening. My name is Sunil Singh. I'm a resident of Short Hills. Before I give my perspective, just like my friends, it is important for the committee to hear about my background, as it may reveal my biases. I work in the financial services industry and have no affiliation or connection to the marijuana industry or associated companies. I have 2 daughters. My elder daughter is in the Millburn Middle School, and my younger one is in the Deerfield Primary School. We are returning residents of Short Hills. After spending 2 years in London, we were residents from 2015 to 2017 and returned back into town last fall. Few of the reasons why we chose to come back to Short Hills were, 1, excellent connectivity to New York City, which is debatable, some days. Excellent school system and low crime in Short Hills. In context of the considerations that the Township Committee is giving to the potential opening of the dispensary, I believe the primary consideration is increase in revenue from taxes. To put that in context, for an annual sales of about $10 million, assuming tax revenues attributable to the county is about 2% on an average, tax collection would be about $200K. To put that in further perspective, it is revenue collected from less than 8 homes, or roughly 8 to 10 homes in the township. Several of our neighbors and friends have talked about how potential costs outweigh tax revenues. I would point the committee's attention to a November 2019 paper that was published in the Journal of Law and Public Affairs at the University of Pennsylvania. Note that UPenn was ranked 7th in the country in the field of law, so we might say it is a reputable institution. The study cites several statistics around economic impact. The one data point that is extremely relevant for today's discussion are the insights from the National Institute of Health that the UPenn study cites. This showed the density of marijuana dispensaries was directly linked to increase in crimes in neighboring areas of the dispensary. Researchers found that in Denver, Colorado, neighborhood near marijuana businesses saw 84.8 more property crimes than neighborhoods without a dispensary. These statistics should be alarming to anyone who is concerned about the safety of our neighborhood and for the safety of our children. I would like to conclude by stating that the incentive for any business is to sell more. Said differently, the incentives of the marijuana dispensary would be to sell more by advertising either formally or through word of mouth in our town and out of town, and to our residents, which includes children. The question that this committee has to decide is if the marginal increase in taxes is worth 1, increase in crime, 2, even a small increase in the risk of usage among children, and 3, other costs which my friends have discussed. As a concerned citizen of this town, I would say no. I would urge the Township Committee to take a long view on this proposal and not a short view. Thank you.
Thank you. Excuse me, please leave your statement with the Township Clerk. Thank you.
Hi, my name is Jean Gerardo. I've lived at 10 Canterbury Lane in Short Hills for 49 years. I've seen the neighborhood change over the years. Mine's a little bit emotional on this issue, especially when it comes to crime. My house has already been broken into in the 49 years, 5 different times. And most of the times, except for one, they parked on Morris Avenue in the parking lots, jumped the fence, and robbed the houses. And this is how a lot of cars are stolen in that area also, parking on Morris Avenue. My other thing is seeing my neighborhood change over the years. We were back to having a lot of little children on the street. And at least 6 of those houses are abutting Morris Avenue, not counting the ones on Claremont and Farley, Damio Place that also abut Morris Avenue, and you also have some on Birchwood. These houses hold small children who like to play in their backyards and front yards, who like to be outside, that don't have to be watched constantly by their parents. You put a marijuana dispensary there, and their lives are going to change. You also have the Glenwood School within close walking distance. You just have to cut through King's parking lot, and you're in the Glenwood area, in the Glenwood School. You also have the high school there. I work in the different schools in town. I am a school nurse, and I work in all the different schools. I see what's going on there. They have enough problems with vaping. They don't need the marijuana dispensary nearby. And I really think that you have to take a better look at this. You'd have more people here tonight if this meeting was next week, but the schools are closed and people are away. So you can't have these people come. Thank you.
Hi, good evening, Mayor, respected committee members. My name is Deneb Shah. I live near Glenwood in Short Hills. There are about 3 marijuana dispensaries in the radius of 5 miles. I have these in Google Maps. They're from Garden State, Cannaboy, and Brown Box in Maplewood. Do we need another one? Not sure. The second thing is, if a member cannot go and physically access this dispensary, they can use a primary caregiver, which is friends, families. So it doesn't have to be at a mile distance. The 3 within the 5 mile radius should be enough to serve anyone who has a physical need or impromptu need on the marijuana dispensary. The second thing is there's a research from University of Pittsburgh, UCLA, and Prevention Research Center, dated 2014. Medical dispensaries is linked to increase of 7% in hospitalization for marijuana cases year over year. This study was taking place between 2001 and 2012 in California, when the marijuana was still medically allowed and not recreationally allowed. There's a national survey poll that was taken by the University of Michigan. This is in February 2019, so just a year ago. 75% of parents expressed concern about it being near a school. And some of my friends have already pointed out how close is this in proximity to Glenwood High School and Middle School. Related to that, there was an article in Washington Post where several 4th graders were caught swapping and selling marijuana. Most of these were legally obtained through medical purposes. Some belong to their granddads. They were, of course, detained, but the studies show that medical dispensaries increase access and availability of marijuana to kids. One last point is there is no standardization of medical marijuana. It isn't like an aspirin or a medicine which has a fixed composition. Composition varies. It's very hard to understand, what's the right, what's in the marijuana. Lastly, I'd like to point to a research from or an analysis from Florida Police Chief Association, where they say that marijuana has related to increase in traffic. The dispensaries have related to increase in traffic by about 154%. So I just want to request and urge that the township take a deeper view as to whether we do need a medical marijuana. Thank you very much.
Jackie, good evening, committee.